prepping medications? Are they getting their clothes ready? And kind of going through each room with a mini check. You know, doing the brushing teeth, the flossing, so they're visibly seeing less and less light. And then the light by the bed is the last one that they see, and then that room is very dark. So those are examples. If people have culturally a siesta, then we look at, is that impacting their work? Is that impacting abilities to engage with other people? If it's not, then I encourage them to keep it as is, unless it's a problem for someone in some way in how they're relating with people. I'm not going to look at changing that for them, because that's a part of their identity. Does that kind of help answer?
I'd like to speak to this because I think this is a extremely unrecognized area of medicine that is relevant for virtually every patient. I don't want to use the word every, so I'll say virtually every patient, regardless of if they're coming into you for sleep, or for cancer, or for diabetes, or for, you know, fertility, or whatever they're coming in for. Circadian rhythms are absolutely important to understand. You know, we have our circadian system is intrinsic to our suprachiasmatic nucleus, and we also have cellular clock genes in every cell that control when that cell is going to do more or less of its function. So understanding circadian rhythms is really key, I think, to being an excellent physician. And it's about 10% of chronic insomniacs who actually do not have insomnia. They have delayed sleep phase. And so I actually have a patient who comes to mind. Do I have time to give a little case?
Yeah.
Okay. So this was a woman in her early to mid 60s, married, long-term marriage. She'd had insomnia for 10 years, which she'd been treating with trazodone and something in addition. I think trazodone and Ambien or something for 10 years. Her husband had Parkinson's, and so she was very busy taking care of him and taking care of all their family business. And she wanted to get off of the medicine. Well, she wasn't sleeping well with the medicines, but she was going to bed about 11 at night, and she was falling asleep about 1:30 in the morning, and then she was getting up at 8 and starting her day taking care of her husband. So she wasn't getting enough sleep, and she was spending 2.5 hours at the beginning of the night awake. And I asked her, "Are you sleepy when you go to bed?" And she said no. She was going to bed because that was the time that fit in with her husband's medication schedule, basically. And so I had her not go to bed until 1:30, and we used melatonin. You can use melatonin as a hypnotic, or you can use it as a chronotrope, which chronotrope is a compound that shifts your body clock. So you take melatonin about 6 hours or 7 hours before the desired bedtime to shift your body clock. So we started out having her go to bed at the time she was sleepy, and shifted her half an hour earlier, you know, every couple days, by having her take melatonin 6 hours before the desired bedtime and using a light box first thing in the morning.
How much did you use? How much?
0.5 milligrams of melatonin, very low dose. And the second appointment, she came in and she said, which was 2 weeks after, she said she was sleeping so much better, and she felt rested. And then 2 weeks later, she came in mostly because I had rented her a light box to try it out, because a proper light box is about $250. Some of these ones you can get at Costco are really not sufficient. But anyway, so she came back in and she said, "Here's your light box. I really don't have anything else to work on. Oh yeah, I stopped the trazodone and the Ambien." And it was kind of amazing. And she had been misdiagnosed as insomnia. Really, she's a night owl, and when her husband started being symptomatic, she couldn't be on her night owl hours. She had to be more on his morning lark hours, and that was the problem. So, yeah.
Can you explain what a light box is for those who don't know?
So, a light box is a therapeutic light that's quite bright, delivers 10,000 lux of full spectrum light. And if you don't want to use a light box, you can go outside. Even on an overcast day, you'll get enough light. Yeah.
Does anyone else want to chime in on that?
I have well, you know, I've been really interested in longevity. I've switched from studying disease to like wellness and what works, which is a fun process. And with longevity, the people that take siestas live longer in general. And they tend to live around the equator, so that may also have an impact on it, probably does. But also the people that meditate live longer. Like meditation is worth 5 years longer, and it changes diurnal cycles. So that's also something that I'll have people do at the beginning and the end of their day, possibly. Or like have a set time to just relax a little bit. And let's see, there was one more thing. If somebody's having trouble sleeping and they want to try something besides Ambien, I'll do herbs. Skullcap latiflora is one of my favorites because it doesn't seem to give people hangovers. And it binds the GABA receptors not as strongly as Ambien or the benzodiazepines really strongly bind to the GABA receptors, and they can kind of shift them so they don't work quite as well. So you have to have Ambien to turn off your brain, which is what GABA does, and it counters cortisol. Well, Skullcap does the same thing. So if say somebody's having something that's upsetting them, they can use Skullcap for short periods of time, but I've been able to wean people off the Ambien and benzos in general using it. And so there are a lot of different tools that we can do. There's Passiflora also has a similar effect, and chamomile has a similar effect, and kava is quite strong, and so that I've kind of veered away from because of hepatic inflammation, but water extracts are supposed to be okay and not cause hepatitis. And so there's different things that we can do herbally while somebody's figuring out their bed. One patient didn't realize what was really keeping her awake and making her feel crazy because she was exhausted and cranky and not like her normal self, was her husband snored because he had incredibly large tonsils. So after she met him, she stopped sleeping and got sort of psychotic, and which is the side effect of not sleeping, is people can have psychosis. And so he ended up getting his tonsils out because they wanted to sleep together, which is a huge deal, but that resolved her problem. So finding out, well, what's actually waking you up during the night? Is it somebody snoring next to you, or you have sleep apnea, or, and seeing if that's something that you can resolve. So, anyway.
Any more questions? Go ahead.
Yeah, I was just wondering how often you refer patients out to get sleep studies, and if most of your treatment is done based on the patient's report of their sleep, or are you also looking at some type of polysomnography, or how do you usually deal with that?
I haven't referred people out, but if you were nearby, I'd probably refer them to you. What you?
Yeah, when I get patients that kind of present with a pretty clear pattern of sleep apnea or a sleep disturbance with regards to their breathing, I'll refer them to their primary care doctor to get checked out and then referred to a sleep study. And one of the things that's nice these days is apparently they have portable sleep studies where you can take a small monitor home as an initial way to kind of assess your sleep. And then if you need to go for the full study, you can do that. Because it used to be you had to go in, got hooked up. The old days, they would have you stay there for 2 nights to monitor your sleep. I don't know about you guys, but the thought of trying to go to bed and sleep with a bunch of electrodes hooked up, it's easier with acupuncture needles. But yes, the sleep apnea or any of the breathing problems with sleep, pardon me, I think are potentially serious enough that I don't like to, I'll treat them, but I want them to also get that checked out because there's so many things that can happen as a result of it.
I would just like to reiterate your last point about the seriousness of it. You know, sometimes people who have sleep apnea feel quite affected during the day. They're falling asleep at stop signs, they're aware of having erectile dysfunction or high blood pressure that just can't come under control. But then there's also the group of people who say, oh, I'm not bothered. Yes, I do have apneic pauses during the night, or I wake myself gasping, but I feel fine during the day, my blood pressure's fine, etc. If you have a patient who has untreated sleep apnea, they are at significantly increased risk for stroke and for heart attack. And so I think it's, you know, it's a disservice to not educate them and make sure that they're aware of the risks of going untreated. And unfortunately, as we age, sleep apnea tends to get worse. So someone who says, oh, well, I got checked 5 years ago and it was mild and I don't want to treat it, they're more likely to have moderate apnea now and severe later if they, you know, if the process continues.
Can we ask questions?
Sure.
So what do you generally do for sleep apnea?
For sleep
For the
apnea,
CPAP machine?
yes, I mean, the standard treatment is to use a CPAP machine, and the CPAP stands for continuous positive airway pressure. And basically, you're using room air, pressurized room air to splint open the airway, so it doesn't collapse and they don't have apneic pauses. It works when a person wears it, and you know, people, you know, it's something like 40% of people who use it most nights or something who are prescribed it. So it's definitely a challenge. It's a mask that goes over the nose connected to a hose that goes to a little air pressurizer that looks kind of shoebox size. So obviously that's not a sexy look that people are going to embrace. But it does work when people wear it. There's other options, some surgical options, some dental devices that pull the jaw forward slightly. And you know, sometimes I've had other naturopathic colleagues who specialize in physical medicine, do cervical manipulations or nasal simpatico, and say that they have treated sleep apnea successfully that way. And I would just encourage you, if you're going to use those techniques, to have your patient be retested afterwards, just the same with doing acupuncture or one of the other alternative medicines, just to verify that it is effectively treated.
Another thing is making sure that their CPAP is fitting. Last year, I was working with a client who talked about sleep as well as anxiety. We're mostly talking about anxiety. At the third visit, she said, well, you know, my CPAP machine, like, I don't think it really fits. And I was like, okay, so let's talk about, you know, we looked online, found a mask very similar to what she's using. Unfortunately, it's the one that is covered by Medicaid, and so it's not going to fit all people. And so then it became, part of my role was advocating with, you know, checking in with her PCP saying, hey, can we get a new prescription for a new mask? She had it covered after, you know, they only cover so many, so frequently. And so then it was writing letters and advocating on her behalf, really, with her PCP of, no, we really need to contact the insurance and say, she actually really does need a new mask. It's not doing the job. And in the meantime, problem solving with her about positioning. There's this thing called the hat trick. I don't know if any of you have heard of this. It's wearing a baseball cap backwards, and then you put the mask over top, because you have the material that will keep the top part of the mask in place instead of it slipping potentially while the person is sleeping, especially if they move around a lot. And then because the bill of the cap, they can't sleep on their back. Like, it prevents them. They'll go to try to move it, and then actually instead they shift into a different, more usually side-lying position. Some people then with side-lying complain about, oh, my hips hurt, my knees hurt. Then you start talking about positioning with pillows in between their knees or in between their hips, or even a pillow up alongside their front of their chest so that they can have their arm over top of it to keep their shoulders more in line. So we work a lot, actually, in OT with positioning in addition to sleep, so that people are not experiencing pain post-sleep, or they can continuously use their CPAP, for example, and be in a sleeping position that will allow them to maintain the use of the CPAP.
How many of you are doing Chinese medicine? Oh.
Oh.
So would it be helpful or interesting if I tell you a little bit about what I do in terms of treating these patients with Chinese medicine? So the first thing, like I said, is I make sure that they go talk to their primary care doc to get things checked out. But from our perspective, sleep apnea is a phlegm condition. Sometimes it's substantial phlegm. A lot of times it's also insubstantial phlegm. And so a trick that I've found when I'm working with these patients is to do gallbladder 41 and triple warmer 5 and open up the belt channel. It relaxes the area around the diaphragm, and when you do that, it also works well with a lot of things like anxiety and depression because it allows for more vertical movement of qi through the body. If you think about it, if you're getting locked up around the diaphragm, you're not going to be able to breathe real well, and it's going to make it really difficult for things to move through that area. So I often will do that first and then kind of monitor their breathing, see how they're breathing on the table. One way to tell if that's going to be helpful is just ask them to do some abdominal breaths when they're lying on the table and see, can they start in their belly and bring the breath up to their chest in one movement, or do they breathe, stop, and then do it again? If they're doing that stop and do it again, then something's getting in the way, and that combination can be real helpful. Bansha Hoputong, or Hopuwan, is a good formula. That's for the plum pit chi sensation, which is the feeling that there's something stuck in your throat, which people who have sleep apnea will often talk about. And then you want to do points. They're going to open the throat, open the chest, move downward. So CV17 is a helpful point. PC6 is a helpful point. You're going to individualize it, but those are the kinds of points that you want to use, and you're going to want to use herbs that help with the phlegm. Watch, what I do too is spleen 3 is another point that I'll use because it tonifies the spleen and tonifies the lungs at the same time. And so the lungs are going to be important for breathing and processing some of the phlegm, and the spleen is going to be really important for that. So I try to take an approach that's going to deal with the individual organs that are involved, but also with an overriding look at the fact that phlegm is really gumming up the works. Yeah.
Any other questions? I saw it back there.
Sorry, I just have one other question. When you're treating people, even that don't come in with sleep issues, do you ever use like timed circadian treatments where you have patients like taking certain things at certain times of the day based on their own rhythm or something like that?
Yeah, I definitely think vitamin D should be given early in the day because it makes a big difference in diurnal rhythms. And then chocolate and caffeine, of course, are better. Some people, if they have chocolate at night, they won't sleep. And there's, oh yes, chocolate and caffeine will keep people awake. And some people are kept awake by certain foods too. You know, like that some you know, like dairy will keep me, it makes me have, you know, restless legs. That took me a while to figure it out, and more mucus too. So try and explore what will make them more restless or maybe make more mucus. I also do ear allergy points. That seems to help mucus in the throat quite a bit. So I have an ear pattern that's pretty magical with the allergy point right behind Shenmen. And then I'll teach people Buteyko breathing, which is a Russian breathing system. And that seems to make it so that people sometimes don't need to use a CPAP. You know, it helps in sleep studies normalize breathing. And then if you can, I've only had a couple people do this, but if you can get somebody to play didgeridoo, it strengthens the whole musculature that gets lax as people get older, and their sleep apnea will also go away. So there are a couple other tricks too. You know, men and women are different, we've noticed that. And women, if they get stressed out, they make more adrenaline receptor sites on their cells. They hypervigilate. They, you know, and men, if they watch like a scary movie, you know, Arnold shooting everybody or something, their testosterone goes up, and their adrenaline will go up a little bit, but their receptor sites go inside their cells. And so they don't react to the stress. It actually de-stresses them to watch some violent movie. And so people are living together. It can be a problem because he's going to want to watch Arnold and she'll want to watch a chick flick, which will just irritate him. And his receptor sites won't go intracellularly. And so that's like media is a really big part of what I look at if somebody's having sleep problems. Because it seems to also, you know, maybe they need like iPads with different movies on them or something like that. So.
Except the electronics at night.
Yeah.
Yeah, the
Interfere with
electronic,
sleep.
Blue light,
the
screen
blue
time.
light, can't have that, so you have to have,
Yellow glasses.
yeah, there's, well, and there's a screen cover that you can use. Anyway, and then EMFs reduce serotonin and melatonin, and so somebody has electricity right next to where they're sleeping, that can change that. So sometimes I'll have people get earthing mats if they're having a lot of trouble with that, and watch what electrical outlets are nearby and see if they can be deactivated.
Can you repeat what you said about vitamin D earlier in the day? I couldn't hear you.
Oh yeah, vitamin D is, affects our diurnal rhythms, and so it will increase cortisol in the morning if you take it then. If you take it at night, it will increase it at night more. Because we wouldn't make vitamin D once the sun gets to a certain thing. Oops, I forgot to turn that off. I apologize. It's probably one of my kids calling. And so, so you want to make sure that you do it in the morning, and so it won't be a problem. There's probably other things. I mean, steroids too. I mean,
Yeah.
yeah, and because vitamin D is a steroid. Make sure that's off.
One of the things that came to my mind when you were mentioning foods and allergies is I've been just kind of at the beginning of my own learning curve looking at histaminergic foods, because you know histamine is an alerting compound, right? And so in some of my chronic insomniacs who are really not responding to some of the other tools that I use that are a little simpler, I'm having them do a week or two of a low histamine diet, which is quite challenging if you're familiar with the foods that are, it's anything, histamine is produced by bacteria when food breaks down. So if anything is fermented, like yogurt or vinegar or ketchup or anything, and then there's other foods that are histaminergic in their own, citrus, tomatoes. So it's a very hard diet to stick to, but I've had a couple people call me back after a week and say, wow, I'm sleeping great. And so that is something that you might try, you might consider if someone has long-standing insomnia. And I want to talk about